It was early last year as I was taking my bath. I saw something like boil under my left armpit. So I rushed to see my doctor. He now did a biopsy on that. Then after a month, the result came out. It was malignant. So I started being worried.
I'm not an emotional person.
A lot of people cannot afford to go for cancer treatment. I'm a civil servant. Where will I get such amount of money? It was war. So we decided to come to Lagos for the treatment. It was not a smooth journey for me. Okay, have a nice day.
The minimum wage in Nigeria is $80 a month. To treat cancer, we're talking around $4,000. We live in a country where religion, culture, and poverty have made outcomes worse. When people are ill, they don't go to hospital first, and would rather go to church, or rather go to the mosque, or rather go to a herbalist.
The diagnosis of cancer has always been looked at like a death sentence, which many people still see it today. Many people would feel that it's better for them not to even know that they have that clinical diagnosis.
So we need a lot of education, we need a lot of patient awareness, we need a lot of advocacy, but we need access. We quickly realized that we could not do this unless we have partners. And one of the biggest partners that have been with us from the beginning, supporting us, upskilling every sector, is BVGH, which is led by Jennifer Dent and her team. So we started having meetings every Friday to review activities, where the gaps were, what needed to be done, how to get resources.
And I think, Mom, we need to be working more closely with you, because I think we've been more connected with the hospital.
The African Access Initiative is the signature of BVGH. What the African Access Initiative does is to negotiate in bulk for hospitals, centers like ours can plug into it and access drugs directly from the manufacturer without going through multiple layers of middlemen.
They have helped to provide a lot of training. They were structured, organized weekly courses on how to do right treatment, how to verify that our treatment is the best and see how we can help the patient get better. These were the things that strengthened our confidence at the initial part to start the center. And so by the time we got all this hands-on training, we were able to move on our own.
I'm not sure we'll be where we are today without this kind of people. The impact is palpable, is why the clinic is full, is why we have recorded great and beautiful outcomes. Within the last 2.5 years, we've been able to actively treat 7,000 unique patients with almost 300,000 patient interactions. That's after they've done it.
On a daily basis, we have an average of 150 to 200 patients. Patients come from all over the country. It brings you joy, it brings you happiness. You can look at the patient and tell the patient comfortably, your cancer is curable.
I did not miss any appointment for one day. I did not miss my drug for one day. I was really down when I came to Lagos, but I'm going home happy, smiling. All I have to say is thank you, Lord. I am free from cancer. Amen.
We've demonstrated that this can be done. We can upskill our local resources, human resource, and then we can get this thing, it can be done. Challenges? Innumerable, but it can be done.